Welcome to another episode of A Conversation with Villa Springfield. I'm Michelle Hemphill, the Marketing Director at Villa. Today I'm so excited. We have a new physician in town. This is Dr. Molina, and he is a spine specialist, orthopedic
spine surgeon.
Orthopaedic spine surgeon, and we are so excited to have you in Springfield.
Oh, well, thank you for having me here.
Yeah, tell us a little bit about yourself.
Well, so I was a Navy veteran.
Oh,
so
wow. Thank you for your service.
Yeah, thank you. So I graduated high school, joined the military right after high school, and so I was right around 9/11, 2000. And I was in the Navy for 6 years, actually as a scrub tech.
Oh, wow.
Yeah, I was a dental assistant and then got trained on the job as a scrub tech. And so 9/11 happened, and so I did a couple of deployments in the Navy. Came back, went to college in South Texas, went to med school in Texas, and then somehow ended up in Kentucky, in Lexington, and did Orthopaedic Surgery Residency there, and met my wife there, and we got married a year ago, so we have a wife and a baby.
Oh, congratulations.
A little girl, thank you. Then went back to Plano for a fellowship and did a spine fellowship at Texas Back Institute. And came back up here. I've been talking to Josh, our practice manager, for the past year and a half or so, even before I left Kentucky,
right,
about building a spine program here in Springfield.
Which we don't have, so this is great.
And he had told me that it was such a needed, population.
Yes.
I grew up in a town similar, very blue-collar town in South Texas. Actually only had 2,200 people in it.
Wow.
So we lived out in the country, which is what attracted me to Yellow Springs, living out in the country. So we have a house out in the middle of nowhere. But I came to Springfield and I fell in love with it. I kind of wanted to go back to a small town and practice. I wear boots and scrubs to my clinic days, so wearing a suit is a little bit
different.
But but I'm very much, I grew up in a small Texas town. That's how I kind of center my practice. We were talking earlier, I like to communicate with my patients.
Absolutely. And you're here every day.
I'm here every day.
Yeah, you're not.
Even on weekends. So.
Right. We can find you.
Yeah, we can find me. And it was a little bit concerning, to start a spine program like that, being the only guy. But somebody has to do it at some point.
They do.
So I really wanted to center my practice around, spine care close to home, or expert spine care close to home. My brother, when he was growing up, had an eye problem, and so this was back in the late 80s, early 90s. And South Texas didn't have any big doctors or fancy hospitals, so we had to drive to Galveston almost monthly to get eye checkups and stuff like that for him. And so that made me realize, that smaller communities need good doctors too.
They do, absolutely. And when you make a trip like that, it's a day trip.
Oh yeah.
And everybody works. How do you take a day off to go for yourself or to take someone else, one of your loved ones?
Right.
And, we want to keep people in Springfield. We don't want people to seek out of town. So to have your expertise here is huge.
Right.
I thank you.
The biggest thing I think is what happens when you get in trouble. People don't mind, I think, driving 2 or 3 hours. It is a pain to do that for an appointment, but what happens in the middle of the night when you have back pain? Or you just had your surgery and something happened to the dressing, or you're still having pain, do you want to drive another 3 hours to go back to the doctor? No. So we did hire a nurse practitioner, so I have a team surrounding me as well, and I just need providers.
Fantastic.
So Melanie Phillips is my nurse practitioner, so she helps a little bit with patient care and other things like that. My office is well versed in, hey, if I have a patient that needs me next day or same day, we'll get them in somehow. So
that's great.
My patients see me every clinic day, every follow-up. They won't see a practitioner or anybody, so I'll be seeing every patient regardless. So I think patients appreciate that kind of concept.
They do appreciate it, and I love PAs and nurse practitioners both, but sometimes you just want your doc. The one that did the surgery, you want to see that person.
Yeah, I couldn't do my job without them.
Right.
But when you're in pain, you're in pain, and and I think that my staff that I have around me, they're great, and they'll be an integral part of the team as we continue to build our spine program. And so I really want to put a face around each of them for my patients, so Because I've had patients that, in the past they say, hey, can I talk to your nurse practitioner or your PA? Something, they form relationships with those people as well.
That's right, whoever you're comfortable with. And being comfortable, we were talking about that beforehand, is half the battle. That's half of your recovery in any situation. So tell me a little bit about the types of spine. I'm sure it's injury or whatever that you can take care of. Yeah.
Pretty much anything. So from just what I've seen here in Springfield, there's a lot of stenosis, and we talked a little bit about going over some of these topics more in detail later on. But so I treat anything from just degenerative arthritis to deformities of either adolescents that have scoliosis or adults later in life. Adults, as our spine ages, we get arthritis, and so we can also develop a scoliosis. So not only are you born, could you be born with it, but you could develop it later on in life.
I didn't know that.
And so, I'm equipped to handle that as well. I mentioned to you previously, I'll be at Ohio Valley as far as hospitals, predominantly, but some of the bigger cases or people that may have heart issues or other problems, we'll take those cases to Soin or Kettering. And the reason for that, I don't mean to travel outside of Springfield, but those hospitals, I've already established relationships with them, and they have the facilities, the equipment, other specialties. Part of during my training, I used computer navigation for surgery. So that involves using computers and real-time imaging to either place screws or cuts and bones, things like that. And so Kettering actually has one of the systems that I use. And so not only am I bringing just spine care in general to Springfield, but innovative spine care.
Yeah, it sounds like it. And then most of the time, I would think if they needed a lengthier hospital stay, you'd have to go to a bigger. I mean, Ohio Valley does overnights, yes, but it still is considered an outpatient surgery center, right?
Yes and no. So Ohio Valley we even do 2, 3, 4-night stays.
Right. We'll
do referrals to rehab centers.
Yes. We work well with you guys.
Skilled nursing facility.
Yes.
But actually, most of my patients actually leave 23 hours after surgery.
Really?
So, yeah.
Now they're spine surgery. Don't come near me.
Yeah. Well, so when I trained in fellowship, we had the mantra of motion is lotion, is like what I like to call it. If you get your patients up and moving, they feel better, they do better, they get less complications such as blood clots, things like that. So I get my patients up 2 to 3 hours after surgery, regardless of what kind of surgery they have, even the big kind of scoliosis surgeries. And if those patients, for whatever reason, don't want to get up, well, then we'll get them up the next day with physical therapy. But I'd say probably 85-90% of my patients leave, like I said, the next day after
That's
surgery.
great. So. And I just remembered I have my mask still hanging on my ear. We're 6 feet apart, so we don't have to wear them. You get used to them. And then I've driven with my mask on, and I think, oh, wonder who saw me.
I think it's always just adjusting to the new normal now.
It is. Every
day it changes.
It is. And when I came into the office downstairs, you guys are practicing total COVID precautions. Explain to people how it's safe to have your surgery, because I know people were leery and kind of backing off elective stuff and different things in the beginning of this whole pandemic. I think people are understanding now that it's safe.
Right. So we actually have everybody at Ohio Valley tested the week before. Similar protocols are in place for Soin and Kettering. So we ask that you get tested a week before and kind of maintain a self-quarantine for the rest of the week until you get your surgery.
Until you have it.
Yeah, I know it's not ideal for most people.
Right, but that's smart. You don't want them to bring something into surgery.
So of course, I myself, I've gotten tested twice since I've been here, and I've only been here 2 weeks. So we make sure that the surgeon's safe, the staff continually get tested. We all use PPE, hand washing, those kind of things. And then after surgery, we can either do telemedicine follow-ups as well. So that prevents you from having to come into the clinic, especially with fresh wounds, things like that. And then even before surgery even happens, I'm offering telemedicine visits as well. And of course, our office, everybody's practicing social distancing.
Oh yeah, it's impressive.
Hand sanitizer and all those
things. You get your temperature taken before you come in the door.
Yeah.
So that's a good thing though. And if everybody sticks to that and wears their masks and everybody does the right thing, maybe there'll be an end to this someday.
Right, definitely. But even as far as surgeries and the COVID risk, in my fellowship, I can't attest to here just yet, but we haven't had any cases of people getting COVID from getting surgery. So,
well, you figure you're all gowned up and masked up anyway
right.
to prevent any type of infection.
Right, and that's another reason to get people out of the hospital. You don't want to
Yes.
hang out where sick
Yes.
people are. So
That's
I always
right.
tell my patients, I'd say, look, you do better in your own house, on your own couch, eating your own food. So
Right. Plus you're comfortable there.
yeah.
So if I wanted to come see you, it depends on insurance whether or not you need a referral. Is that correct?
Correct, yeah.
Okay.
And I'm probably not the best person to ask, but we've actually have a lot of co-management agreements with primary care docs downtown.
Okay.
So we're able to give them that information. We also have a relationship with a lot of practice managers.
Yes.
So I've given everybody my office number, my phone number. They all know how to get a hold of us. So I tell the primary care providers, hey, if you have a question on whether or not I can see you, or if I do that particular problem or procedure,
Right.
just let me know. So
That's great. And I will have Dr. Molina's information all at the end of this too.
Correct.
So they'll know who to call and,
Yeah.
and website and all
and
that
we're also
stuff.
I'm on Facebook and Instagram,
Oh, great.
YouTube.
Just under your name? Or,
Correct. Yeah.
Okay.
And so I have a page on all those as well.
so we can find you everywhere.
Yeah.
That's good. So you've been here 2 weeks.
2 weeks. Yeah.
That's great. And you're starting to pick up a little bit. If people have like a routine pain, back pain, which a lot of us do, is that a reason to come see you?
Yes and no.
Okay.
I hate to take away from the
No.
primary care providers downtown. And we had even gone so far as maybe thinking about doing like a Monday morning urgent care back
Type
clinic or
thing,
something
yes.
like that. So those ideas are still in the works.
Mhm.
But I don't mind if patients come and see me if they just
If it's a chronic
yeah,
back pain issue or,
If your insurance allows it, you to, I'm more than
Yes.
happy to start the workup from the beginning
and see
and
where
see
it goes.
back pain. Yeah. I try not to be, or not try. I am not one of those surgeons who's, you have to have an MRI before you come see me. If you're hurting, your back's hurting, that's all you need to
Right.
see me. So.
Well, that's great. I mean, I know, we all know people that have had chronic back pain or have had back surgery 20 years ago and it still has never been right.
Right. And I think the worst thing for patients too is that when you're in that back pain for that long, you hate to jump around from office to office
You
until
do.
somebody finally figures out, hey, this is how I get you to see Dr. Molina.
Yes.
So,
Right.
so if they just call and we can figure out how to get them here and go from there.
That's perfect. Perfect. Well, I really appreciate you speaking with us today.
No, thank you very much for that.
We are also going to do a community Zoom, I would say presentation.
Yeah, webinar, or however we can do it.
Yeah, however you want to call it. So stay tuned for that. I'll make sure we get that information out on our Facebook page. You put it on your
One of my
Facebook
pastimes
page.
is actually in education.
Oh, great.
And I had a love for academics, before this, and so I think the best thing is to teach these patients, even if I can teach them a little bit about their problem, then information is key. So
It is.
especially when you're dealing with your own health, and I think that people just kind of gloss over patients, and then you get in this cycle where you're stuck in this whirlwind of like disinformation, as well as trying to find the right doctor. And so if we can kind of cut a little bit of that out, I think that'll be good.
And that's a great approach because I do think, especially with chronic pain or any of that type of thing, or your back, you get frustrated. And you get frustrated because you go to different entities and you hear different things. And you've already got a relationship with the primary care docs here in town. That's your main person that needs to know everything.
Right.
And then you also aren't quick to go do back surgery. I mean, there are other things, right?
Yeah, because I try to treat people like they're my family. Like if that was my brother or my sister, would I offer you surgery, or so I try to look
What's
at
the
it from
best?
that point of view.
Right, that's great. So there are things you can do besides surgery
Oh,
to help
definitely.
people.
I've partnered with some of the pain management groups in town.
Okay.
Not for pain management as in the sense of like pills and things like
Mhm.
that, but injections are actually a good procedure for
Right.
back patients. and there's other different procedures as well some of the therapists talk about more intensive home exercise programs, videos online that patients can look up.
Oh, that's
those
great.
kind of things. So,
yeah, because once you learn them, if you stay consistent with it, I would think that would help.
Right. And I think all these resources are in Springfield already. I think it's a matter of somebody just bringing people together and guiding patients on where to go.
Keeping them all on the same page with it. That makes perfect sense to me, and that's wonderful. And I think a lot of times when you have so much pain and you go to do something and it hurts, then you stop doing something. It's just a vicious cycle. So if you can break that cycle and deal with the pain and let them get to the point where they can exercise or get back to some kind of normal life.
And a lot of it's expectations and impressions. If you go to a doctor and they say, well, I'm going to send you to therapy, and you've already been to 5 doctors who have sent you to therapy, you're not going to be willing to do it. But if that last doctor sits down and talks to you and tells you why therapy is going to be good for you, what it's going to involve, how it helps you, then you kind of buy into it, and then you're like, okay, well, I'll really give it a shot this time.
Well, and if they have a doctor like you that's going to oversee all of it and stay in contact, like you said, communication is the key. I think sometimes they just send you to therapy and that's the last of it,
Yeah. And even my patients that I don't do surgery on, I still follow them. I don't shift them to a PA or an MP or another non-surgical doc. I still follow all those patients as well. So, and like I said, it just helps to be involved, and like you say, as long as somebody is really guiding them on the path that they need to be.
Right, it just keeps you going, keeps you motivated. I think that's half of it. Yeah. Well, again, thank you so much
Thank you
for being with us and taking a little bit of your time. I'm sure you're busy.
Yeah. Well, like I said, I'd
come
be
talk to us.
happy to give more lectures or anything
Yes.
on these.
Well, I think we'll schedule one as soon as we can, and I'll let everybody know. And maybe what we can do is do a couple on different topics
Yeah, definitely.
to see what people are interested in.
I'm looking forward to it.
Well, thank you very much. Thanks for being here. And thanks Ohio Valley and Springfield Orthopaedics for allowing us to do this video. And until next time, thanks for tuning in to a conversation with Villa Springfield and Dr. Molina.
Thank you very much for having me.
Thanks.
Thank you.